Good day everyone, my name is Kenneth Velasquez, a student nurse from Davao Doctors College, Section 12A and Group 24. So today I will be performing my written demonstration for administering parenteral medication. So we have the intradermal route with the angle of 10 to 15 degrees, subcutaneous route with the angle of 45 degrees, and intramuscular route with the angle of 90 degrees. Now let's go for the general preparation for the three, since the general preparation in the progress report is just the same for the three routes, and I will just demonstrate it as one. So for the general preparation of the three routes, first and foremost is we will be checking the doctor's order and also check the medication administration record as well, or the MAR. So we have to consider this because we also have to consider this part, that the chart of the patient is more reliable than the medication ticket. Next is we will be checking the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. We also have to check the expiration date here, so it's okay. And this is important because for us to prevent the error of any medication administration. Now, follow the three checks for administering medication. Read the label on the medication when it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication. So that is 3 times. This is for us to ensure that we are giving the right medication and right dosage to the patients. Next is we will be organizing the equipment for us to save time and energy. And after organizing, we will be performing hand washing for us to deter the spread of microorganisms. Next is preparing medication. Let's go first for the preparation of intradermal route. Here, we will be preparing the medication vial for drug withdrawal, and of course, mix the solution by getting vial and rotate the vial between palms, and remember not to shake. So here, we will be removing the protective cap or clean the rubber cap of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. Disregard. And some vials contain aqueous suspensions which settle when they stand. Then, withdraw the medication. Attach a filter needle to draw up a premixed liquid medications from multi-dose vials, and ensure that the needle is firmly attached to the syringe. This is for us to avoid injury and error. And of course, let's unpack the intradermal needle. Always make sure to disregard all of the wastes. Remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn, so that we can easily get the intended right amount of medication. Carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle for us to avoid any contamination. So for example, we will be needing 50 units. So here, let's have some air. Then inject the air into the vial, keeping the bevel of the needle above the surface of the medication. So here, withdraw the prescribed amount of medication and hold the vial down with the base lower than the top. Then move the needle tip so that it is below the fluid level and withdraw the medication. Invert the vial, ensure the needle tip is below the fluid level, and gradually withdraw the medication. As I have said earlier, we will be withdrawing 50 units. Then you can also tap this one to avoid some air. Next is after this one, place the cap. Place it here. Next is preparing medications for the subcutaneous routes. Here, we will be preparing the medication vial for drug withdrawal. Again, mix the solution by getting a vial and rotate the vial between palms, and remember, do not shake. Then, as I have said earlier, clean the rubber cap of a previously opened vial with an antiseptic swipe by rubbing in a circular motion. So, as I have said also earlier, some vials contain aqueous suspensions which settle when they stand. Next is withdraw the medication. Attach a filter needle to draw up the premixed liquid medications from multi-dose vials and ensure that the needle is firmly attached to the syringe to avoid error. Remove the cup from the needle and draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn, so that of course we can easily get the intended right amount of the medication. Then, as I have said earlier, carefully insert the needle into the upright vial to the center of the rubber cup, maintaining the sterility of the needle to avoid any contamination. So here, let's assume that we will be getting 5 ml. Next, withdraw the prescribed amount of medication. Hold the vial down with the base load at the top. Move the needle tip so that it is below the fluid level and withdraw the medication. Now, invert the vial and ensure the needle tip is below the fluid level and gradually withdraw the medication. Then, uncap or place back the cup. So next is preparing medication for the intramuscular routes. Prepare the medication ampule for drug withdrawal. Flex the upper stem of the ampule several times with a fingernail. By flicking this will cause the air bubbles rise. Of course, here you can use an ampule opener or place a space of sterile gauze or alcohol white between your thumb and the ampule neck or around the ampule neck, and break off the top by bending it toward to ensure that the ampule is broken away from yourself and away from others. Now, we will be placing the antiseptic wipe packet over the tip of the ampule before breaking off the top. This is to break the ampule easily and remove the dust around the neck. Now, disregard in the correct receptacle. Then disposes of the top of the ampule in the sharps container rather, and this is to reduce the risk of cuts and potential exposure of accidental injury of glass shards. Now, withdraw the medication and place the ampule on a flat surface to prevent accident and injury. And as I have said earlier, attach the filter needle or straw to the syringe and remove the cup from the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with a needle tip or sharp to prevent accident. And with a single dose ampule, hold the ampule slightly on its side if necessary to obtain more than the ordered amount of medication. This is to obtain all the medication while keeping the needle sterile. Now, dispose of the filter needle by placing in a sharp container, and this prevents the nurse and others from accidental injury. Now, if giving an injection, replace the filter needle with a regular needle, tighten cap at the hub of the needle and push solution into the needle to prescribed amount. And this is for us to prevent glass shards from containing the medication. So, we have prepared all the medication. So, let's proceed with the intradermal route administration. First is we will be explaining the clients the effects after administering this medication for us to gain cooperation and reduces the apprehension. Hello, ma'am. I will be doing a skin test for you today for us to assess if you have any other medication reactions or allergies, okay? Okay. Do you have any other questions so far? So, next is we'll be providing the client's privacy. This is to protect the client's integrity and enhance comfort, and you can close the door or close the curtains. Now I am going to select the forearm about a hand's width above the wrist. This is an area free of tenderness, hardness, swelling, itching, burning, and localized inflammation. This is to avoid or lessen discomfort during the infection. Now we will be applying gloves for us to infection prevention measures. And applying the gloves is also one of the precaution and protection. So after, we will be cleaning the site using a firm circular motion to prevent entry of microorganism into the tissue. This is wet, then dry. Now remove the needle cap while waiting for the antiseptic to dry. And drying the skin prevents inactivation of the meds or drugs being given. Now expel any air bubbles from the syringe, because small bubbles that adhere to the plunger are no consequence. But a small amount of air will not harm the tissues. Grasp the syringe in your dominant hand close to the hub, holding it between the thumb and forefinger, and hold the needle almost parallel to the skin surface with the bevel of the needle up. Then we have to position the needle 10 to 15 degrees, because the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. Now inject the fluid, and with the non-dominant hand, pull the skin at the site until it is taut, because taut skin allows for easier entry of needle and less discomfort for the clients. Now insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. Stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal on the skin. If a small wheal appears, all solution are in intradermal tissue, and after that, then withdraw the needle quickly at the same angle at which it was inserted. Then discard this one. Encircle the wheal with a blue or black pen and instruct the patient or watcher not to rub the wheal or erase the mark. Hello sir, I want you to be informed to not erase this circle one here, okay? Thank you. So red pen may influence the reading, and massaging the area may interfere with the test results by spreading the meds to subcutaneous tissue. Activate the needle safety device and applies a bandage if indicated. Here, because it minimizes tissue damage and discomfort for the patients. Do not massage the area, as I mentioned a while ago. Remove and discard gloves, and then wash hands to deter the spread of microorganisms. Now, we will be documenting all the relevant information, record the testing material given, the time, the dosage, routes, because for documentation purposes that the procedure was done and the means of communication. Next is that we will be evaluating the condition of the site at 30 minutes depending on the test. Measures the area of redness and induration in millimeters at the largest diameter and document the findings. Document the client if he had a positive or negative skin test result, and follow agency protocol and labeling of allergies. So here, positive result is greater than or equal to 15 millimeter, but however, negative result is 14 millimeter and below. Next is we will be preparing for the subcutaneous route administration. So first, of course, perform hand washing, and I have done that a while ago, and provide for clients' privacy. This is to provide comfort and respect individual confidentiality. As I have mentioned, close the door, secure the curtain. Prepare the client, introduce ourselves, and verify the client's identity. This is to establish rapport to prevent error in medication. Hello ma'am, good day. My name is Kenneth Velasquez and I will be doing a subcutaneous injection for you. Do you have any other questions, ma'am? How's your day going so far? Okay, that's good to hear. Now, assist the client to a position in which the arm or leg or abdomen can be relaxed depending on the site to be used. This is to provide comfort. So now obtain assistance in holding a cooperative client, and since the patient is being cooperative, we don't need to have any assistance at all. Next is explain the purpose of the medication, a language, effects of medication to gain the patient's cooperation. And after, we will be selecting and clean the sites and select a site that has been used frequently. The site where a skin appears to be healthy and free from irritation and inflammation reduces the discomfort of injection and precautionary measures. I will be using the abdomen of the patient for the subcutaneous injection. Hello ma'am, I will be inserting subcutaneous medication for you. This is for your health, ma'am, and I want you to be informed that you will feel sick after or any redness here, but you have nothing to worry about. These are the indications that the medication is taking effect. Do you have any other questions so far? Okay, thank you for that. Now apply clean gloves, and I have already done that. This is to prevent transmission of microorganisms, and the agency protocol is that to clean the site with an antiseptic swab. Start at the center and clean in a widening circle about 5 centimeter. This is to allow the area to dry thoroughly, and place and hold the swab between third and fourth fingers of your non-dominant hand after. Dry, wet, then dry. Place this one here. And position the swab on the client's skin above the intended site. But I will do this because friction aids in cleaning the skin and remove dirt in a way direction. Now we will be preparing the syringe for injection and remove the needle cap while waiting for the antiseptic to dry. Discard. Then, pull the cup straight off to avoid contaminating the needle by the outside edge of cup. This is helped to ensure to avoid contamination, and drying the skin prevents inactivation of the drugs being given. Next is we'll be injecting the medication. Grasp the syringe with your dominant hand by holding it between your thumb and your fingers, with the palm facing into the side or upward for a 45 angle insertion, or with the palm downward for a 90 angle insertion. Prepare to inject by using the dominant hand. I'm left-handed. When grasping will create a firm hold. Next is to secure the entry of the needle into the subcutaneous layer, and we'll be removing the needle cap while waiting for the this is to avoid contamination of the needle. And using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand in a firm, steady push. And pitching pulls the fatty tissue away from the muscle and makes the injection easier. When the needle is inserted, move your non-dominant hand to the end of the plunger after. So some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the dominant hand to the end of the plunger, and injects the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. For support and easier injection of solution, this pressing the skin places counter interaction. Now remove the needle and remove the needle smoothly, pulling along the line of the insertion while depressing the skin with your non-dominant hand. It minimizes patient's discomfort when the needle is withdrawn. If bleeding occurs, apply pressure to the site with dry sterile gaze until it stops. Discard in the receptacle. Now, disposes of supplies appropriately, just like what I've done a while ago. Discards use syringes and the like. This is to protect the nurse and others from injury and contamination, especially from the patients. Assist the patient into a comfortable position. Flip down the medication ticket if not using the MAR. So, of course, comfort and convenient, do aftercare, remove the gloves, and dispose used items in appropriate waste receptacle. Then, return the other equipment to its proper place, especially the MAR machine. This is to prevent injury, to prevent spread infections, and prevent the spread of microorganisms. Perform hand washing after to deter the spread of microorganisms. Assess, of course, the effectiveness of the medication at the time it is expected to act. Then documents all the relevant information for us to prevent medication error and to promote database for future. So many agencies prefer that medication administration be recorded on the medication record. Of course, now let's proceed with the intramuscular route administration. Organize the equipment for us to save time and energy. Then perform hand hygiene rather, and observes other appropriate infection prevention procedures. This is done to deter the spread of microorganism. Next is to prepare the medication from the ampule or vial for drug withdrawal, because organization and planning results in economy of time and effort and minimize confusion. Now we will be providing for clients' privacy. Providing the client privacy protects our client's integrity and enhances comfort. Of course, closing the door and securing the curtain. And prior to performing the procedure, introduce ourselves and verify the client's identity using agency protocol. Introducing yourself enhances rapport, and verifying client's identity ensures care is being rendered to the correct client. Hello ma'am, my name is Kenneth V. Velasquez, your student nurse for today. Before we start, may I see your wristband, please? Can you please tell me your full name, ma'am? How about your age, ma'am? So, what would you like me to call you, ma'am? Okay, Tabitha, how's your day going so far? It's nice to hear, and I really hope that our day will end up a good one. So, do you have any other questions? Okay. So, assist the client to a supine, lateral, prone, or sitting position depending on the chosen sites. If the target muscle is the gluteus medius or the ventrogluteal sites, have the client in the supine position, flex knees in the lateral position, or flex the upper leg and in the prone position tone in. Positioning the client in a comfortable position increases our efficiency in performing the procedure. Obtain assistance in holding an cooperative clients, and explain the purpose of the medication and how it will help using the language that the client can understand. Include relevant information about the effects of the medication to gain the patient's cooperation. Hello, Ma'am Tabitha. Mao ni imuhang injection karon o I want you to be informed na mura lang ning paak sa alamigas, dali lang siya 1 2 3 unya hawa dayon, okay? Do you have any other questions so far? Side effects, maka-feel ng kag mga maluya-luya kagamay mamagsuka-suka pud ka, but you don't have to worry about that, Ma'am Kay. Nagka-science na siya na nagka-take effect imong tambal, pero if naman kay mga sinati nga lain, please do tell us to that, ma'am, okay? Okay. So next, we will be selecting or locate and cleanse the site. Select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. If injections are to be frequent, alternate the sites, avoiding using the same site twice in a row. Locate the exact site for the injection. So the site where the skin appears to be healthy and free from inflammation and irritation reduces the discomfort and infection or precautionary measure. So apply clean gloves. Again, pathogens on the skin can be forced into the tissues by the needle. And clean the site with an antiseptic swab using a circular motion, because friction aids in cleaning the skin and remove dirt out in away direction. Wet. Dry. Now, transfers and holds the swab between the third and fourth fingers of your non-dominant hand in readiness for needle withdrawal, or position the swab on the client's skin above the intended site, again to prevent needle prick injury, and seeing needle through the skin serves as a guide to the depth of insertion. So, prepare the syringe for injection, remove the needle and cover and discard without contaminating the needle. This is helped to ensure and to avoid contamination. And drying the skin prevents inactivation of the muscle drugs being given. Now, inject the medication using the Z-track technique. uses the ulnar side of the non-dominant hand. Pull the skin approximately 1 inch to the side under some circumstances, such as for an emaciated client or an infant. The muscle may be pinched. Holding the syringe between the thumb and the forefinger as if holding a pen, pierce the skin quickly and smoothly at a 90-degree angle. This is to ensure insertion of needle into the muscles. And then hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back with the plunger using your dominant hand. So, aspirate for 5 to 10 seconds. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. But if a blood does not appear, inject the medication steadily and slowly, approximately 10 seconds per ml. While holding the syringe steady, if using the ventrogluteal sites, after injection, we'll wait for 10 seconds if using the ventrogluteal site to ensure that the needle tip is located at the desired site and has not accidentally punctured a blood vessel. Then, after this, we will be withdrawing the needle smoothly at the same angle of insertion. And here, apply gentle pressure at the site with a dry sponge, and it is not necessary to massage the area at the site of injection because it minimizes patient discomfort when the needle is withdrawn. So again, if bleeding occurs, apply pressure with a dry sterile gaze until it stops. Then activates the needle safety device or discard the uncapped needle and attach the syringe into the proper receptacle. This is for us again to prevent injury, prevent spread of infections, and prevent the spread of microorganisms. Remove and discard gloves and perform hand hygiene after for us to deter the spread of microorganisms. So after hand washing, we'll be documenting all the relevant information, the time of the administration, drug name, dose, route, and the client's reaction. Prevents medication error and to promote database for future. Okay, so assess the effectiveness of the medication at the time it is expected to act. So that's it for my parenteral medication return demonstration. Thank you for watching.